Patient care first.
March and the protests are to raise awareness to the patient, the cuts to patient care that are pending May 17th, which were announced just on February 28th. The government has been described as bullying our Pharmacists Association into accepting a deal that will put many people out of work and will make wait times enormous for patients and will land a lot more people in the emergency room and waiting at their doctor's offices. There are cuts to the specific funding model that we have in place. So for things like follow-ups for somebody with diabetes, to the overall pharmacy budget has just received a massive cut of $150 million for the services that everyday Albertans receive in pharmacies. I think consulting pharmacists to look at ways to save is a smart move because we see people coming and going. We're an entry point and a point where people leave the healthcare system in many cases. As I say, pharmacists provide care from birth to death, cradle to grave. So pharmacists see the public, what the public has to pay for and what they get, and pharmacists also see the private side of things. So I think pharmacists are a great group to engage. We're problem solvers, we have big hearts and great math skills. However, we have not been engaged on that level, no. Frontline services you take for granted every day, they are being cut. It's going to cost taxpayers more in the long run. You would say this is a penny smart but pound poor government, is how it was described to me. But we would like to respectfully engage with the Health Minister, Sarah Hoffman, and have her sit back down to look at those numbers and understand the crisis that we're facing.